Thanks very much. Good evening, everyone, and thanks for coming out. And again, thank you to the patients that are here to tell their stories. And of course, the London Academy of Medicine, thanks for organizing this event. I think it's very important that we have these discussions. I also serve as the health critic for the party, and I'm co-chair of our health policy committee as we're developing new policy as we head into the election year coming up in the next little while. I do want to touch upon a few things of how we've reached this position in our healthcare system, how it's unfortunate that doctors are now speaking out and bringing patients together to tell their stories. After 14 years, this government's mismanagement money has caused them to make changes in the way they budget the system. And a few years back, they decided they could no longer budget the natural increase in our healthcare system, which led to freezing of our hospital budgets for 4 years. And you'll notice that every year we lose more staff, more nurses are fired, our custodians are privatized, or services are cut. At the same time, they decided that they wouldn't negotiate in good faith with our doctors. About 3 years now, doctors have been working without a contract. Instead, the government has taken to the task of vilifying them in the media, if you've been following any of the media over the last few years. And we've reached a point that doctors are fed up. And when you upset and not work with your healthcare professionals, you tend to upset the balance in the healthcare system. What this government has done over the last few years is invest heavily in the bureaucracy and management of our healthcare system. They just passed a Bill 41, Patients First Act of all things. And what that has done is created 76 new sub-LHINs. At the same time, they've just hired 84 new vice presidents for all our LHINs. They continue to spend more and more money into the management and bureaucracy structure instead of the patients. 2 years ago, the Auditor General released a report, the CCAC funding, that only, or 39% of that funding does not reach the patient care. It gets lost in the bureaucracy. So we need to hear these patient stories going forward so the government realizes the effects they're having on people in our Ontario healthcare system. And I'm very grateful that you've stepped forward. The other thing I want to make point of, you'll also hear this government talk about how recent Fraser reports have ranked us #1 in Canada with regards to wait times, access to timely care. But you look at the Commonwealth Fund, which is really the gold standard of measuring wait times. It compares Canada to all the other westernized countries, Sweden, United States, other European countries, I don't want to name them all. We're constantly 13th or 12th place with wait times and access. So we're not doing well, in my opinion, I think anybody's opinion, of what we expected out of our provincial healthcare system. The other thing that we want to raise is we hear about wait times. The government's saying our wait times are improving, but we never hear the wait times it takes to get a hernia fixed, gallbladder surgery. We don't hear the wait times it takes to get your ankle fixed if you need to see an orthopedic surgeon. Those, I think, are the bellwethers in our healthcare system that we need to hear those wait times. So the wait times to see a specialist. Not the specialist to the surgery or a specialist to the treatment, but the wait time to actually get to see that specialist. Or if you look at across the province, mental health, it's getting a lot of play in the media, which is great. We need to talk about it more. But because we're talking about it more, we're having more people needing to access that help. Unfortunately, the province hasn't followed up with supports. You look at our children's mental health. We have excellent doctors, nurses, psychotherapists working in our system, but they don't have the funding in order to make that care. Ottawa, I think, is 18 months a child has to wait. I think in the London area, it's about 9 months to actually get the treatment they need. If you sit back and think if your child broke their leg, as a parent, would you be acceptable to wait 9 months to get that leg fixed? We can do a lot better. And the way we can do better is reaching out to patients and hearing their stories and taking those to the government so they start to listen to us. And I think that's why we're all here tonight. So again, thank you very much for being here. And I'm always asked, you really are a London MPP? I am a London MPP. I'm the small one, I guess. I have Lambeth in South London. But the way London is growing, if you leave here and go down Wonderland Road, you hit my house in less than 15 minutes. So I'm probably closer than Peggy and Teresa to come into tonight. So anyways, have a great night.